That's not even a prolonged field care thing. That's just a good medical practice thing. As you and I, probably both know, as we're both here in North Carolina, our recent hurricane took out 50% of the U.S. IV fluid production temporarily. But I think sometimes these resource limitations that we encounter, either due to public health emergencies or due to temporary loss of manufacturing capacity because of the hurricane or things like that, sometimes can lead to improvements in care. And those improvements in care are relevant to the operational setting, right? Like during the pandemic when we were running short on IV hydromorphone, for example. Turned out we could manage a lot of pain in the ICU with oral medications. We should probably do more. And this limitations in IV fluids, hasn't had a massive impact on us, at least in my hospital. And part of that, it's had some. Mostly it's because, we can manage a lot of these people orally.
It's the 12th.
It's the 12th bag. And this actually becomes very important in managing someone with severe dengue, right? Because one of the ways you will get into trouble is volume overload. And that capillary leak isn't just happening in soft tissues. It's happening in the lungs. It's happening in the pleural space. It's happening in your gut. It's happening in your kidneys. It's happening everywhere. And with that, it is not terribly difficult to drive someone into respiratory failure if you just keep slamming them with fluids over and over again. Now, again, fluids are the mainstay of management, but there is a happy medium. We had when I was on active duty, we had an outbreak of hemolytic uremic syndrome among some service members, and there wasn't a lot of data on how to manage HUS, infectious caused HUS in adults at the time. We have since published some of that based on our experience, but I do remember getting advice based on the pediatric data saying, just keep pushing fluids. You can't hurt them. And I was kind of taking that with a grain of salt as an adult intensivist. But I remember when I walked in one morning on rounds and was immediately crash intubating a 19-year-old. Yeah, I think we can sort of definitively disprove the fact that you can indeed. Yeah, you can't hurt young people with fluids. Now you can.
Yeah, absolutely. With dengue, kind of going full circle, if you were giving advice to a young medical provider going into the tropics, alone and unafraid,
exactly,
about dengue, what things would you want to tell